Hi, I'm Sandy Moss. I'm one of the board members and one of the support group leaders for the Scleroderma Foundation Rocky Mountain chapter. June is Scleroderma Awareness Month. As part of our awareness efforts, some of the members of our Scleroderma community are getting together to give you some facts about scleroderma.
Hi, I was diagnosed with scleroderma in 2008.
Scleroderma is a rare autoimmune disease in the same family as rheumatoid diseases such as rheumatoid arthritis and lupus.
Scleroderma is difficult to diagnose.
Many patients that have scleroderma suffer for years before getting an accurate diagnosis.
Unfortunately, there are over 7,000 new cases of scleroderma diagnosed every single year.
It took me 10 long months and 5 doctors to get a diagnosis.
I am one of 300,000 people living in North America with scleroderma. 80% of the people diagnosed with scleroderma are women. There is no known cause yet for scleroderma.
Usually, people get scleroderma from ages 25 to 55, but it can also happen to children. I was first diagnosed when I was 9. My mom and I thought it was a bug bite, and the doctors told us it was nothing to worry about. But then my aunt, who was also a doctor, pointed us towards getting this checked out, and it turns out it was scleroderma.
Over 90% of scleroderma patients suffer from acid reflux and Raynaud's. With Raynaud's, the blood flow and oxygen levels to our hands and feet, and sometimes other parts of our body, are greatly reduced because of vascular spasm. For some of us, like myself, we experience painful and often hard to heal ulcers because of the reduced blood flow. And that is why gloves are our best friend.
Scleroderma means hard skin, which can cause the tightening and thickening of skin. Scleroderma can also cause severe internal damage to the organs such as lungs, heart, kidneys, esophagus, and gastrointestinal tract. I myself have diffuse scleroderma, which has caused damage to my heart, lungs, esophagus, and gastrointestinal tract. As a matter of fact, today is my 4-year anniversary of my stem cell transplant used to help to slow the progression of scleroderma, for which there is no cure.
Over 30% of scleroderma patients will develop pulmonary hypertension. Pulmonary hypertension forces the right side of the heart to work harder to move blood between the heart and the lungs. It can cause dizziness, shortness of breath, and fatigue that gets worse with physical activity. It typically requires the use of supplemental oxygen, and it gets worse over time.
Medications can sometimes lessen symptoms, but there is no cure. Although these treatments help comfort some of these symptoms, it often creates complications and worsens others.
The Scleroderma Foundation provides emotional and educational support for scleroderma patients and their families. The foundation has granted over $15 million in research grants since 1989 and continues to budget an average of $1 million annually for peer-reviewed research funding. Please help us spread awareness of scleroderma by sharing this video or by making a donation to the Scleroderma Foundation today. Thank you.